Hi, I'm Miranda. I'm a nurse practitioner student with Texas State University, and I'll be performing your physical exam today, okay?
Okay.
What is your name and how old are you, sir?
Jack H. Matata, I'm 29.
And what do you do for work?
I'm a welder.
Okay. So before we get started and into the exam, I would like to give you a couple of words. Table and penny. If you'll try to remember those, okay? I'm going to ask you about them in a minute.
Okay.
Table and penny. Now, what brings you into the office today?
Just to establish a primary care provider.
And what is today's date?
9/18/2016.
And one thing I would like to ask is, who is president?
Obama.
Who was president twice, the 2 terms before?
Bush and Clinton.
Okay. So we have long-term memory established, and if you can tell me again the words we just talked about.
Table and pen.
Very good. Very good. So we've also established an appropriate short-term memory. What I would like to do next is just take a look at your general appearance. I see that you are overall well-nourished. You've got a good amount of muscle mass on you. You don't look calm. You look calm. You don't look very anxious. I can see that you don't have any obvious disabilities or deformities. Okay, what I would like to go ahead and do now is take a look at your fingernails. And I'm looking for any kind of clubbing or cyanosis of the digits and the nails, and I don't see any. Your fingernails are pink, and capillary refill is less than 3 seconds. I'm feeling your hands for any lumps, nodules, and I don't see any. Do you have any tenderness?
No.
Okay, your hands are warm to touch, and they're not excessively dry or moist. So I'm going to palpate up to your arms, all the way to your shoulders. I don't feel any lumps. Any nodules, anything of great concern? Do you have tenderness there?
No.
Okay, so I'm going to take it back down. I'm going to assess your radial pulses. Okay, I got a +2 there, and then your brachial pulses. Okay, +2 there also. So what I would like to do now is have you raise your shoulders to my resistance. Very good. Okay, that's great. So, let's see. The next thing I would like to do is assess your joints. We're going to check a couple of reflexes, and what I want to assess now is your biceps. Reflexes. Relax your arm. Little pump here. Okay, you've got a good positive reflex there. Brachial radial. Very good. That's a good reflex. And we're going to do your triceps. Relax your arm. Okay, that's great. And I'll do this side. Okay, got a positive there. And brachial radial, positive as well. And let me do your triceps on this side. So just relax. Good. So I'm still looking at your arms. I would like to note that if you had any lesions, I would make sure to note the location of it, along with if there was a certain pattern or a shape to it. I would take note of any characteristics of exudate, along with when they started, the odor, what the color of it. I would also look to note the width, length, and the elevation of it in centimeters, and I would document that. Next, what I would like to do is I would like to check your range of motion of your hands. If you will move your hands and your wrists all around, next to your elbows, and at your shoulders. Okay, now I'm going to assess for strength. So if you'll push against me, now we're going to go up and down, push out, and in, and your shoulders once again. Okay, that's great. Now what I want to have you do is we're going to assess your range of motion of your hands, of your, coordination. I need your finger to touch your nose and out, other hand, finger to nose and out. Now I want one of your fingers to touch my finger and then your nose and follow it. Other hand. Very good. Again. All right. The next thing we're going to do is I'm going to assess your axillary node right here, anterior, medial, posterior, and lateral, and I don't feel any swelling or lymphadenopathy there. The next one I'm going to do is the epitrochlear, and I don't feel any swelling there either, so that's great. The next thing I'm going to do is I'm going to have you just take a look at your head, and I see that it's atraumatic and normal cephalococci, so next I'm going to palpate. I am assessing for brittle hair, infestation of the hair. I am assessing, I don't feel any nodules. I don't feel any very palpable suture lines. Do you have any tenderness there?
No.
Okay, that's great. So next thing I'm going to do is I'm going to just take a look at your face. I see that your face is symmetrical. I don't see drooping on either side. Skin color is appropriate. I don't see any nodules or masses on either side. If you will make a frowny face for me. Okay, puff your cheeks. All right, cranial nerve 7 is intact. Next, I'm going to assess, both looking and palpating, your maxillary sinuses and your frontal sinuses. Do you have tenderness there?
No.
Okay, I'm going to percuss. That's great. The next thing that I need to do is I just want to take a look at your cranial nerve number 3. Sorry, cranial nerve number 5. That's a facial nerve. Tell me, close your eyes and tell me if you feel anything.
Yes. Yes. Yes.
Does that feel the same on either side or stronger on one side or the other?
Same on both sides.
Good. Next, I'm going to take a look with the light here. Now I'm going to look at your red light reflex, if you will stay looking straight ahead there. Red light reflex is present. And red light reflex is present. Next thing I want you to do is we're going to assess your fields of gaze. So I want to make sure that your ocular movements, according to cranial nerves 3, 4, and 6, are working appropriately. If you will follow my finger, please don't move your head. Don't move your head. Okay, we had smooth horizontal and vertical eye movement without any nystagmus, so that's great. Next thing I want to take a look at is with the light, I'm going to assess your pupillary response. And I've got a direct pupillary response. And I have a consensual response with the opposite eye. Again, on this side, I have a direct pupillary response and consensual on the other side. Very good. So pupils are equal, round, reactive to light, and if you'll follow my finger, that's great. Your eyes also accommodate and converge in your vision. The next thing I would like to do is perform a cover test where if you will just look at me, I'm going to quickly remove one of them. I'm going to cover and then quickly remove, and I want to see if your eyes remain focused on me. So just relax. Okay, both eyes remain focused on me. Both eyes remain focused on me. Very good. The next thing we're going to do here is I'm going to look at your eyes. I just want to make sure we don't have any swelling of the conjunctiva. I don't have any ptosis or lig lag. I want to make sure that there are no foreign bodies, that your eyes are symmetrical. I don't see any irritation, redness, or swelling. The next thing I would like to do is to go ahead and look at the sclera, cornea, and iris. So we're going to do and this will also transition to a fundoscopic exam. This is going to be a bright light, okay? Let me start. Okay, so what I can see here is that the optic disc is kind of an opaque in color. Cup to disc ratio is 2 to 1, and I see an AV ratio of about 2 to 3. I don't see any nicking at all. The vessels look intact. Retina is intact. And that looks pretty good overall. Following that, I would like to go ahead and take a look at your ears. Your ears look symmetrical. I don't see any exudate, swelling, any erythema. normal. They look, I don't see any excessive cerumen on the side. I'll go ahead and perform an internal ear exam. Okay, so what I'm looking for here is I'm looking inside the ear. Let me know if you're uncomfortable in any way. Pulling back the pinna, and I can see that the external ear canal is unobstructed. The bony-like structures are also unobstructed. I don't see excessive cerumen or erythema. I can visualize the tympanic membrane, and the membrane is gray and pearlescent in color. I'm going to look on this side. Again, it's unobstructed. I don't see any excessive cerumen. Bony-like structures are unobstructed. Cone of light is in the anterior inferior quadrant, and the tympanic membrane is gray and pearlescent. Next, I'd like to go ahead and check your hearing. We're going to perform the Rene and Weber test. So first, I'd like to start, and you let me know if you can hear anything, okay?
Yeah.
Which
Both
ear?
sides.
Good, both sides. Now this time I'm going to put it on your mastoid process, and you let me know when the sound goes away.
Okay. I can hear it.
Okay.
Okay. I can hear it.
Very good. All right, so air conduction is greater than bone conduction, which is normal. The next thing I'd like to do is I'd like to just take a look at your nose. It looks midline. I don't see any deviation or lesion. I'm going to go ahead and palpate now. I'm also going to palpate the maxillary sinuses, the frontal sinuses. Do you have any sensitivity there?
No.
I'm going to go ahead and percuss. Any pain or tenderness?
No.
Okay. And I would like to take a look inside the nose. Let me change my probe there. I am looking to see that the nasal mucosa is pink, it is moist, without any lesions or polyps, bilaterally. The next thing I would like to do is go ahead and assess your temporomandibular joint. If you can open your mouth and relax your face, side to side. Okay, I want you to push against my hand. Push against my hand. Very good. That was great. I would like for you to go ahead and start checking your mouth. I'm going to give you just a general inspection. What I can see, you'll open up there, is I can see that the buccal mucosa is moist, pink. I don't see any lesions, ulcerations. All of the teeth are intact. Don't see any dental caries. Overall, it looks like dental hygiene is kept up well. I can visualize the tonsils at a 2+. They are not erythematous. The the uvula, if you will say ah. Okay, sorry, gag reflex. The uvula moves upon phonation and is midline. I would like to have you clench here. Clench here. All right, both the motor function there is appropriate. Cranial nerve 5 is intact. Otherwise, I would like to go ahead and just take a look at your neck. I see that the skin is intact. I don't see nodules, lesions, rashes anywhere. Skin color is appropriate without any cyanosis. The next thing I'll do is I'll go ahead and palpate your neck. Again, I don't feel anything, any lumps or bumps that should not be there. Okay. I'm going to go ahead and assess your trachea. It is midline, and it is movable. I'm going to check your lymph nodes. Here are your pre-auricular lymph nodes, post-auricular lymph nodes, occipital lymph nodes, the submandibular, and the tonsillar lymph nodes. This is submental. Okay, here's your superficial cervical lymph nodes, deep cervical lymph nodes, and posterior cervical lymph nodes, along with the supraclavicular lymph nodes. All of those feel non-swollen and no lymphadenopathy. The next thing I'd like to do is just take a look at your thyroid. I'm going to go ahead and try to palpate here. I do not feel it to be enlarged, and I also don't feel any abnormal nodules. One thing I'd like you to do now is go ahead and shrug your shoulders. Okay, cranial nerve 11 is intact. I would like you to try to turn your head against my hand. Very good, that's great. Next thing I want you to do is we're going to go ahead and move on to your chest. If you'll spin around for me. Let me know if you're uncomfortable in any way. So I'm just going to look at your back and thorax, and I see that the skin is appropriate to color. Skin is appropriate to color. Upon palpation, you are warm. I don't see any central cyanosis. I don't see that you are using accessory muscles to breathe. Your chest expansion rises symmetrically upon inspection. And I'm going to go ahead and palpate here. Okay. Rises upon inspection symmetrically. And also looking at you, I don't see that you have any heaves, any retraction or dyspnea. Everything appears to be symmetrical. So let me take a look here. Palpate again. Again. Breathe in. I'm going to check for a tactile primitus. Say one-on-one.
One-on-one.
Say one-on-one.
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 And one-on-one.
One-on-one.
Very good. I'm going to percuss now over the lung fields. Okay, I did not assess any agophony or hyperresonance there. Next thing I'll do is I'll take a listen to your lungs, and when I tell you, you'll just breathe in deeply for me. Okay, breathe in deep. Breathe in deep. Very good. Okay, now I heard that your lungs were clear. I did not hear any rales or wheezes or other dyspneic sounds. I'm going to listen now for your lateral breath sounds, okay? Breathe, deep breath. Very good. Now on this side. Okay, that's great. Next thing I'm going to do is, those sounded nice and clear as well. Lastly, I'm going to, on your back, I'm going to check for costovertebral angle sensitivity. And this is going to be checking your kidneys. So if you'll just tell me if you have any sensitivity here.
Nope. Nope.
Okay, very good. It's almost like a reflex. Okay, if you'll spin around, I'm going to check your anterior chest. Yeah, I'm looking at your anterior chest. I see that the skin is even throughout, appropriate to your skin tone. I see that there is a really very minimal hair distribution. Is that normal for you? Okay. I don't see any rashes, erythema, noted nodules anywhere. I'm going to look and see that you are breathing pretty easily. I can see your respiration with the rise and fall of the chest. It is symmetrical. I'm also looking to see if you have any. Okay, no, I see everything looks pretty good there. I'm going to check. I'm going to feel for any tenderness. Let me know if you have any. No tenderness?
No.
I'm going to check real quick for skin turgor. I hope this doesn't hurt you. I'm just going to make sure there's no tinting there. Very good. Skin turgor is appropriate. You do seem to be hydrated. I'm going to listen now for lung sounds. You can breathe in whenever you feel me move my, my stethoscope. And one more. Last one on this side. All right. Sounds good. So I would like you to go ahead and lay down now. Let me clear my space a little bit. So upon general inspection of the abdomen, I am really just making sure that you don't have any visible lumps, bumps, any visible hernias, there's no convexity or concavity to your abdomen. That is what we like to see. I'm looking to make sure that with light palpation you are not having any kind of pain. I'm going to go ahead and auscultate, and I will listen to your bowel sounds. You do have active bowel sounds. I'm going to go ahead and listen with the bell now. Okay, that was very good. I think I will have you listen to your percuss. Any pain there?
No.
Right. Let me know if this is hurting.
No.
I'm going to go deeper now. I don't feel any abnormal organ borders there, and I would like to go ahead and assess your liver. If you will please take in a deep breath. Okay. Do not help. And on the other side, I'm going to check for the spleen. Now on your left side, checking for the spleen. Okay. And that feels all right there. No organ engorgement or enlargement. I would like to go ahead and check. I'm going to listen to your cardiovascular system. Taking a look at the precordium, I don't see any heaves or thrills. I don't see any jugular vein distension. I would see that better at a 45-degree angle, but I don't have a concern. I don't see that right here. The next thing I think I'm going to do is I'm going to notice the skin characteristics of your chest. It looks clear. I don't see rashes, erythema, any nodules. I'm also going to see that you're not using any particular strain in laying down. If you will lift your head. Okay, very good. And let me take a listen. I don't feel any heaves either. I'm going to listen to the aortic area, the pulmonic, herbs, tricuspid, and mitral. I'm going to do that again with the bell. Aortic, pulmonic, herbs, tricuspid, and mitral. Okay, that all sounds pretty good. I'm going to try to feel your PMI now. I've got a mid-clavicular line and find the fifth intercostal space. Okay, coming across, I can palpate. And with my watch, I assess that to be about 68 beats per minute. Normal. I can also feel it to be regular rate and rhythm. I did hear an S1 and S2 earlier, so I'm going to call that about a normal sinus rhythm, just on auscultation. Next, I think what I'll do is I'll go ahead and I would pull out the table extension for you if we had one, but you appear to be pretty comfortable right now. I'm going to move down and I'm going to check your inguinal nodes. I don't feel any lymphadenopathy there. I'm going to check your femoral pulses. They're about a 2+. I'm going to check your popliteal pulses. Those are again are a 2+. Your dorsalis pedis. And your posterior tibials, and both of those on each side are 2s. So now I'm taking a look at your legs. I see them to be symmetrical. You have even hair distribution. I don't see any patches of hair missing. Your skin is warm to palpation. I don't feel any lymph. I don't feel any nodules or masses on your legs. With your feet, I feel your pulses are present. Feet are also warm to touch, and I'm checking your capillary refill and your toes, which is also less than 3. I don't see clubbing on the toes either, or any cyanotic or color changes. I would like to go ahead and assess for range of motion of the hips. So if you will let me move this leg up, we're going to go in and out and extend. Now I want you to do that by yourself. Now we'll switch legs and do the same. We're going to go in, out, and extend, and retract. Now do that by yourself. Okay, if you'll sit up, we're going to check your patellar reflexes. Okay, so just here. We have a positive reflex there and here. Positive reflex there. I'm going to check your Achilles reflex if you'll move your foot to my shoulder. Relax here. Okay, we have a positive reflex, and on this side. Very good. So now I'm going to check the range of motion of your knees and strength. So if we can check your range of motion, I'd like for you to move your knees in and out, pull them up to you. Okay, now I want to check for strength if you will raise one at a time. Okay, very good. Now I want to check the range of motion of your ankles. Okay, if you scoot back a little bit just for the video. And go ahead and I want your ankles in and out, up and down, all the way around. Okay, and I would like to assess the same on the other leg, in and out, up and down. Okay, that's very good. I think I also want to have you check your strength of the legs here along with your hip strength, in and out. Okay. If you can jump down, I'm going to assess your gait. If you'll walk a few steps that way, heel to toe, you could just walk first. And then walk back to me. Now you'll go heel to toe. Okay, now on your heels and on your toe.
Oh, sorry.
It's okay. Okay, if you'll stand here with me, I'm going to check a Romberg sign. So if you'll just close your eyes, feet together, I'm going to assess your sway. Just try not to move. And we don't have excessive swaying or loss of balance. I would like to check your, if you'll bend over for me, I'm going to check, scoot over this way. Bend over. I'm going to check the curvature of your spine from the lumbar, thoracic, to the cervical, and I don't feel any abnormal curvature at all, so that is very good. Lastly, I'm going to have you show me the range of motion of your spine. If you can twist around like this, and backward, okay, and forward. Okay, I think that was very good. Okay, and throughout the procedure, I've been watching your posture. Your posture appears to be pretty straight, slight slumping, but overall you've got good curvature of the spine with proper spinal alignment. So I think that is all. You did a fantastic job. Thank you for being my volunteer. Thank you very much.